Probably. Yeah, she can answer every question. All right, guys, everybody ready?
I'm ready.
All right, but by clock, it is 6 o'clock, so at this time, I will officially call the January meeting of the Macon County Board of Education to order. Welcome everyone for coming. Nice day, but it's probably going to be a little nippy when we get out of here after a while, so it is what it is. It's that time of year. As always, we're going to open as we get into the meeting, we're going to go with a moment of silence and our pledge of allegiance, so if you would, everyone please rise. And we turn to our vice chair, Mr. Cave, who will lead us into our moment of silence.
Oh, we've done it for a while, and, you know, watching the news, hearing the news, but we're getting ready to send more soldiers overseas, and that's not good, some way of looking at it. But we got to protect our country and our people. So that, and I also throw in EMTs, policemen. There's a lot that needs help right now, and the good Lord may be the only one that can help some of these people. So bow our heads, we'll think of these people. Amen. Thank you.
Time again, if you would give us honor, lead us in the pledge of allegiance, sir.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Tom. Everyone, please be seated. Moving into next on there is approval of the minutes. All the board members received a copy of the minutes from our regular scheduled meeting on the 13th. Were there any questions, changes?
Move we accept as presented.
We have a motion to accept those as presented. Do I hear a second?
Second.
All in favor, say by saying aye.
Aye.
Any opposed? So moved. Next is the adoption of our agenda. I'm not aware of any changes. Dr. Baldwin? No, sir. Anyone? Directors? All right. At this time, then, we will, I'll entertain a motion that we adopt the agenda as presented. Do I hear that motion, please?
So moved.
And a second.
Second.
All in favor, say by saying aye.
Aye.
Any opposed? So moved. Very good. Spotlight on people and programs. I understand, Dr. Baldwin, at this time that we don't have any recognitions tonight, correct?
That's correct.
Under presentations, the first thing we'll go will be under combination thank you face coverings and our NC toolkit update, correct?
That's correct.
All right, I'll turn it over to you.
Thank you, Mr. Chair. Tim, if you'll pull our current isolation list up. Scroll to the right just a little bit, please. There you go. Make it a little smaller. When I arrived at the office this morning, we had 24 positive students, and I think it was 114 quarantines. And as you can see, that over the course of the day, that number did increase by about 14 students, positive cases. We had 12 positive staff this morning, and that's grown to 15 this afternoon. Now, you know, with the 5-day quarantine, that has created a situation that's very fluid. Our numbers change dramatically from day to day. For instance, tomorrow, scroll up, Tim, please. You'll notice that there are 6 students positive at Tortuga James, but 5 of those students will come off of quarantine tomorrow. What we're learning is with the change in the quarantine, 5-day quarantine and then 5 days of masking, that's down from a 10-day quarantine. It's sometimes difficult to assess that a student actually is, student or staff, is positive until their quarantine is actually over. For example, if a student comes to school say they came to school today feeling poorly, and then their condition didn't improve overnight, they decided to be tested tomorrow. If it's a PCR test, they may not have the results back before Thursday or Friday. And if that's the case, the exposure would have begun today when they first started having symptoms. We'd get the information out to students. Those students who were exposed today would actually be off quarantine by Monday of next week when they learn of their quarantine. So it's a fluid situation. Sometimes we'll find out that a student will show up positive on my list, but they'll only be on that list for a day or two before they're off. So it's things changed pretty dramatically. Now, we also learned on Friday that staffing issues would force Macon Middle School to revert to remote learning for at least 3 days, beginning today. And you'll notice that Macon Middle School has, if you'll scroll down, Tim, please. You'll notice that Macon Middle School, too far. Nope, you're going the wrong way. There you go, okay, sorry. Macon Middle School has 9 staff out, 4 are positive, and 5 are quarantined. What's also not on this list, though, is staff who may be at home caring for their children who are quarantined, or may have other illnesses other than COVID-19. Those don't show up on the list. So there are at least 9 staff out at Macon Middle School. Most of those staff can return by the 27th, and that's when we hope to be able to return to in-person instruction at Macon Middle School. Today, 30% of Union Academy staff were unable to report to work, and therefore they reverted to remote learning at least through Thursday. We hope to have in-person instruction to return at Macon, or at Union Academy on Friday, the 28th. As I said, most of the staffing issues are due to COVID, but we're also seeing other illnesses in the community right now that are impacting our ability to staff our schools, whether it's bus drivers, custodians, cafeteria workers. Staffing issues are a challenge right now. Let's look at that there you go. Now, this information I sent to Tim today at about 3 o'clock, so it was up to date as of 3 o'clock. I think we picked up 3 positive students from 3 o'clock until now. If you can scroll to the right, Tim, just there you go. That's good enough. Okay, this is our the graph to the left represents student quarantines, and you can see how they fluctuated over the course of the past school year.
That's actually staff. You would need students.
No.
That's students.
That was students. There you go. They peaked, we hope they peaked on around the 3rd week, and then also the week when we returned from Christmas break. We did see a decline last Friday. Now, that current dot should be, instead of 34, it should be 38. So it does go up slightly on the student positive list. But it is not where it was a week ago after Martin Luther King's birthday. If you scroll down to staff quarantine. We are seeing with this most recent surge a greater impact in our staff than in students, and that's reversed what we saw back in September. We saw our student impacts to be slightly greater. More students seem to be coming down with positive cases than staff, and so it's a little surprising that we're seeing the numbers in staff that we are at this time, and don't really know what the reason might be behind that. Board members, do you have any questions about the positive cases and quarantines over the past school year or the past few weeks? Tim, if you can scroll down just a little bit, you can see that I did add the date of, no, go back up just a minute. You can see that the October 29th date, that was the week after. Actually, it was the Friday of the week that the board made the decision to go to mask optional. And then I've also noted December the 17th, which was the weekend right before Christmas break. And you can see that over Christmas break is when we saw the greatest spike. All right, scroll down, Tim, please. Going down a little further. Total number of cases now, if you'll go to the left, think it's 680. Scroll down. 671 in total for the past 2 years is 895. Keep going just a little bit, please. All right, at this point, we do have 46 identified in-school transmissions. And you can see where those were located. One at Cartuga J Elementary. Whoa, scroll up. There you go. One at Cartuga J Elementary. We've had none at East Franklin. Only 5 at Franklin High School. 3 at Highland School. None at Iowa Valley. None at Early College. 2 at the middle school. 2 at MVI. And this is where the data is somewhat anomalous, in my opinion. We have 10 in-school transmissions at Hale School, our smallest school, and the same number at South Macon, which is our largest elementary school. And those two cases, those two schools represent nearly 50% of our in-school transmissions. I think that's questionable. Tim, if you'll scroll down just a little bit as well. Okay, now, right there. Now, as of 9 o'clock this morning, when I put this graph together, from August the 23rd through October the 25th, 29 of our positive cases were the result of in-school transmissions. We had a total of 453 positive cases in the school system on October the 25th. 29 of those were in-school transmissions, or what we believe to be in-school transmissions. That represented 6.4% of the cases. From October the 25th to December the 16th, we had 65 total positive cases. 3 of those were in-school transmissions, or what we believe to have been identified as in-school transmissions. That's 4.6% of the positive cases were the result of in-school transmissions. Then from December the 17th to now, when we've seen this most recent surge, we've had 300 positive cases, and 14 of those have been identified as probable in-school transmissions. That represents 4.6%, 4.67% of the total number of positive cases that were a result of in-school transmissions. Any questions about this information?
I guess the one thing that stands out to me, though, is we were in school from October 25th to December 17th. And from December 17th to January 24th, we were only in school for 3 weeks of that. So in 3 weeks, we had 14 transmissions, whereas in 2 months, we had 3.
Yeah, we're definitely seeing a surge.
It seems like it's trending to be more in-school transmission. Like that to me is growing faster.
Because we weren't in school over Christmas break.
Yeah.
And at 6 point something, yeah, 4 point something, I don't know. Sounds low.
I'm just looking at the time. That's over in 3 weeks, we had 14 transmissions in school, as opposed to 3 in 2 months.
Well, I think that you have to also consider that some of the positive cases that we had over Christmas break, you have to consider the lag time between the time of the exposure, the incubation period of the virus, and then when it actually exhibits in the person. So you have to consider that lag time going back to when Christmas break began, and then also after Christmas break is over. But I definitely see your point. Any other questions about the in-school transmissions over the course of the past school year?
That's student and staff.
That's student and staff. That's total. And the reason for that is it's really hard to pick out from the health department's information when the student or staff in school transmission might have occurred. Scroll down, Tim, please. And this is information that relates to quarantines. From August 23rd through October the 25th, we had 1,472 quarantines as a result of 453 positive cases. That's 3.2 quarantines per positive case. From October the 25th to December the 17th, we saw 449 quarantines as a result of 65 positive cases. That's about 6.9 quarantines per positive case. From December the 17th to January the 24th, we've seen 785 quarantines as a result of 300 positive cases, or 2.62 quarantines per positive case. Any questions about that information? And going back to the question about the student cases over Christmas break, the health department was still reporting student cases and quarantines over Christmas break.
It's just like it suddenly ceased. They were continuing.
They were still being reported. Now, I think that when school is in session, you have a likelihood of seeing an increase in numbers because of the quarantines. If a student tests positive through the contact tracing, all the individuals that might have been in close contact with that person are notified and then quarantined. And as a result of the quarantine, they might be more likely to be tested so that they can return to school with a negative test more quickly. Now, I don't know that that's what's actually going on. That's just my best assumption. Because going back to that question about, Tim, if you'll scroll up, about the in-school transmissions, this is the only information that we have for Macon County schools. I know that that isn't perfect, and if you'll go back, Tim, to that original, unless there's any other questions. Tim, if you go back to the first sheet. For the health department, if you'll scroll to the left. There. No, to the left. Scroll. There you go, right there. At this point, we've seen over 2,700 quarantines. That means 2,700 contact traced individuals have been sought out by the health department, by our school nurses. Their contact with an exposed, or their contact with a positive student has been confirmed. That student then has been notified. They are tracked as to when they can return to school. Their symptoms are tracked while they're out of school. This is a tremendous amount for our health department to keep up with. I know that that their information isn't perfect, but it's the only information that we have for our school system.
I think that's a little bit much of them. Everything that's going on with them, certainly for them to be any more accurate than what they already have to be, bluntly. I think they've done a good job.
And especially now, as I said, with those quarantines, when the toolkit changed, Tim, if you want to go ahead and pull the toolkit up. When the toolkit changed on January the 10th, I believe it was, and the length of the quarantine was reduced from 10 days to 5 days, but a student was required.
Is this the updated one?
No, that's not the updated one. Doesn't look like. Scroll down.
It's updated August.
Did you send me
I sent you the link for the page that I was looking at. I just went to the address page and clicked on it. Yeah, updated January the 10th. We'll scroll on down. These are some of the changes that we saw on January the 10th. Keep going, turn pink. I think it's on page 10. Keep going. Keep going. A little further. Here. The information in red is what changed, and if you'll scroll down just right there. No, actually go down a little bit further to exposure. Right there. Right there. You're good right there. Exposure. This is what changed for us that had an impact. Previous to January the 10th, if a child was exposed in school, they were required to be quarantined for 10 days. On January 10th, that changed from person in a mask optional setting for whom an exception to exclusion does not apply and has been in close contact with someone with COVID-19. The person must be excluded from school for 5 days after exposure. Person may return to school after exclusion if asymptomatic, but must continue to wear a mask for an additional 5 days, for a total of 10 days after exposure. The 5 days of exclusion begins on the day after the last known close contact with COVID-19, with the COVID-19 positive individual. They should test on day 5 if possible. If symptoms occur, a person should immediately isolate until a test either confirms COVID-19 or a negative result rules it out. So, as I said earlier, that reduction of that quarantine really makes it difficult for the health department to manage when a person actually is exposed, has been tested, and then must quarantine. Many times we're finding that they're actually being told of the quarantine, or we're learning of the possible quarantine after that first 5 days is already up. So it's created a real challenge for us to keep track with who might have been quarantined, who is required to wear a mask, and who can actually return to school. Scroll down just a little bit more, Tim. All right, so for another challenge that we're seeing is just the sheer complexity of determining what is required now within the Strong Schools Toolkit. For example, a person in a mask required setting, which we are not at this time mask required, and has been in close contact with someone with COVID-19, in which one or both individuals are not wearing a mask the entire time. So in a mask required setting, individuals are not required to be excluded from school after a close contact, including unmasked exposures during lunch or extracurricular activities. If they have no symptoms, individuals with unmasked exposures in mask-required school settings should get tested on the day of notification of exposure and as close to day 5 after exposure as possible, and must wear a mask in school settings. This exemption applies to in-school exposures as described above, as well as non-household out-of-school exposures. While the individual does not need to be excluded from the school setting, quarantine measures may still apply in non-school settings. If testing supplies limited, priority should be given to testing of students participating in athletics because of the higher risk of transmission in that setting. That's a challenge to try to keep up with. Does anyone have any questions about the current toolkit or what our current data in school systems is showing?
Questions?
Nope.
Is that all, Dr. Baldwin?
Yes, sir.
All right, board members, you know, we were charged from the state that for every meeting, we do have to make a decision in terms of mask policies versus a mask mandate or requirement or mask optional. We're at that stage, so at this time, I'll open the floor for a motion, then we'll have a chance for discussion of that, and we'll move forward. So at this time,
I move that we remain in mask optional as we have for the last 3 months.
have a motion to refrain mask optional. Do I hear a second?
Second.
Have a motion to second. Any other discussion, board members?
Do we know the positivity rate in the county right now?
Yes. The CDC it reports that as of through January 20, let's see, positivity rate is to the 23rd, and the positivity rate right now in Macon County is 36%. 36.32%.
And what was our threshold when we started the school year?
Threshold?
We said, are we in,
We're talking about
we
the color.
used to go through color zones, and there was orange zone and red zones, and when we got to yellow, I think is when we voted to take masks away. Do we know does that put us in a...
Yeah, we're transmission level high, Macon County, the whole state of North Carolina, virtually the whole country.
My memory, Hillary, was at that point, once you hit, I think it was 10%. Once you
Yeah,
hit
it was
10% positivity rate,
8%.
or 8, then that clicked it into the next level down, where it went from, I get them confused, from orange maybe to yellow, something along those lines. And I think that was, I don't remember where we were. I don't think we were in the yellow when we did. I thought we were still in the orange, which has been...
I think we were like almost to yellow. I think it was real
it
close.
was close. We're still
Are we in
orange.
red right now?
We are in red, and I believe the reason that we weren't in yellow at that time was because our case rate didn't drop below 50 cases per 100.
But we were
Or
close.
100,000. Yeah, we hadn't quite got there yet.
But I think shortly before we did it, and yeah, in terms of, this is one of those things where it goes, but yes, at that point, positivity rate was in the range we're talking about, and now it is higher than that amount that we were when we made that decision. Any other discussion? For me, it's all about the in-school transmissions is where I'm coming from.
But we're saying according to the toolkit, and that's the guidance that we
Right.
have to go by, is that if they are, the first 5 days, they're quarantined. The second 5 days, they come back to school.
Yes.
But those students should be wearing a mask that second 5 days.
Correct. Not should, they will have to.
They'll have, that's what
Yes.
they're
What the
telling us
toolkit
that
says.
has to happen. Is that-
Correct. That is correct. I mean,
That's public
protocol.
health.
That's the CDC guidelines, and that's what we are following.
And that's what we have to follow.
Correct.
Mr. Gibbs is working with the principals to make sure that the school nurses have an adequate supply of the K95 masks, which are now recommended. It's my understanding that cloth masks they've deemed are not as effective, and therefore we're making sure that school nurses have an adequate supply of the KN95 masks.
And those are the masks that we are currently having, that students will be wearing. We'll make those available to them.
We have a supply of about 45,000 of those. Correct?
Yes, sir.
And have those children that are coming back after 5 days, are they wearing masks like they're supposed to be doing it? Like the health professionals will tell us what needs to be happening?
And that's what, if you refer back to the toolkit, it says that even if they are wearing a mask, it has to be worn appropriately, and that is determined by the school nurse and the teachers involved. I know when we were mask required, we did have more quarantines than we anticipated, because at some point it was determined that the masks weren't worn appropriately at all times, and that led to more quarantines during the mask required portion of the school. I'm not sure how they will make that determination during the 5 days of required face coverings. Now, what will be considered appropriate under the new CDC guidelines?
And we're required, we're supposed to be following the CDC guidelines to some degree. Is that correct?
So is that something that this board needs to have to make the vote then, another discussion and vote in terms of how to try to have the mask 5 days covered, such as they come in, they check in the mornings with the school nurse and they're assigned a mask? Is that something we will need to do? Or is that protocol within the schools themselves?
We had a principals meeting on Friday and discussed how we would handle the new toolkit guidelines, and the determination was made by the principals that students who are identified as quarantines would be required to stay at home for 5 days. When they return, they go to the school nurse. The school nurse would provide them with the KN95 mask.
A fresh one.
A fresh one. Teachers would have a list of students who should be required to wear a mask. And if a student is out of compliance or refuses to wear a mask, then they would simply have to honor the full 10-day quarantine at home rather than at school.
I have a question about the schools that are having to go virtual. If we were in a mandatory mask mandate, would they have been able to stay in person?
Well, if you look at the student numbers, that's not what has led us to reverting to virtual instruction. It's been the number of staff positives that we have. And 15 staff positives and the 10 now it's up to 11 quarantines. And going back to that, what the toolkit says about in person, both folks wearing the face covering. If you can pull that one back up, sweetie. Right there. So you have two. And the big advantage for a staff member, or a student for that matter, is the vaccination. Because if you look at exposures, exemption vaccinated, the person who's been in close contact with someone with COVID-19 and is one of the following groups. They're 18 years of age and have received their primary series and booster if eligible. They're between the ages of 5 and 17 and have completed the primary series of COVID-19s. Boosters are not required to meet this exception for this age group. Those folks do not need to be excluded from school if they have no symptoms after being in close contact. The person must still continue to wear a mask for 10 days after the exposure to minimize the risk. Now, in our situation, in a mask optional setting, those folks who have not been vaccinated, a person in a mask optional setting with whom exceptions to exclusion do not apply and hasn't been in close contact, that person is excluded from school for 5 days after exposure. The person may return to school after exclusion if asymptomatic, but must continue to wear a mask for 5 additional days.
Clear as mud.
Now, prior to this, the January 10th revision, it made an impact on student exposures, but staff exposures, even if both individuals were wearing a mask, they were required to quarantine. It's not very clear right now as to if it will make a difference in staff or not. I asked Kathy McGaha a question about that, and she sent me this
They
Dr. Baldwin, I think I can help a little bit with this question. I think that the test to stay protocol, when you're in a mask required setting, was intended to take the edge off of the phenomenon we saw when you were mask required, but still saw your quarantines going through the roof because of determination somewhere along the line that the masks weren't being worn appropriately. What that says is if you're mask required all the time and we can determine that the kid tests and tests negative on a voluntary basis, and the same thing applies to staff, but only for in-school exposures. So as Dr. Baldwin's saying, you can implement that. If you're mask required, you can implement the test to stay program. But if 50% of your staff is being exposed outside of school, it won't help you stay home. Because they're still required to quarantine.
Thank you, John.
And again, with a total of, I think we're up to 800, what's our total number of positives at this point? We've had 157 staff positive. Yeah, I think it's about 818, or at least it was at 3 o'clock today, 818 total positive cases in the school system, and 46 of those 818 have been a result of in-school transmissions. Now, and again, you have to understand that is, it's considered an in-school transmission when you have an exposure and then one of the close contacts tests positive. That doesn't mean that they definitely caught it from that exposure, because with our community transmission rate the way that it is right now, it's highly likely that they caught it outside of school or at home. As a matter of fact, with 818 positive cases and only 46 of those cases being deemed possible or probable in-school transmissions, if I go to the list and look at each individual school and where that child was exposed and how they determined that they were positive, or for that matter the staff, there is a significant number of identified exposures that are outside of school. Dad, brother, sister, mother, boyfriend, husband. It is in the community.
So, I guess my last question about that. Well, I've lost it. I had it in my head. There's too many things. Too many things.
Another part of that is I talked about, we really have no idea of the positive cases we had. We have no idea of tracking who's been vaccinated and who hadn't. There's no way to
I remember.
pinpoint that.
Nowhere else in the county has a mask mandate, is that correct? I know Highlands does not currently have one
Under the
right
government
now.
or no one else has it, correct.
And there is some information about vaccinations, and I think the health department has that. For example, they do on the, Jim, if you'll pull that list of the current isolation list back up and scroll to the right. They do provide this information. The health department provides that to us, and I can go. There is a list that I can see.
This is not a comment on my part, Dr. Baldwin. I don't think we need to go there, to be honest with you.
Well, I guess my question is, everybody's moving about pretty freely everywhere. Right. It would just be at school where they would be wearing the mask anyway.
Yeah, correct. All right, guys, I think we've discussed it. We have a motion on the floor. This time I'm going to call for a vote. The motion was by Mr. Kay that we remain in the mask optional. So all in favor of that, please say by saying aye.
Aye.
Any opposed? So moved. Moving forward, our school system will remain in the mask optional status. Thank you, Dr. Baldwin, for all that work. I know it's a lot of facts, and board members, thank you all.
That was excellent.
Yes.
Your numbers. That was very helpful.
Yeah. Next is our time for public comment. We would ask if you want to address the board, if you would, we have the stand there. Please go there. Just tell who you are and go from there. First is Julia McCrae. Ms. McCrae, if you'd still like to address us, please come up.
Hello, everyone. It's been a while since I've seen you. I hope you had a Merry Christmas and a Happy New Year. Thank you for your vote. So a lot of what I'm getting ready to share is just informational at this point. But I'm here to present some data on where we stand with COVID-19. So the current death rate is 1.2% in the nation, 0.8% in the state, and 1.3% in our county. Child deaths are still virtually non-existent, with most being attributed to those with severe medical conditions. As of today, the national death rate for children 17 years or younger is 0.15%. All of this information is coming from the CDC's COVID data tracker and the NCDHHS's COVID-19 dashboard. I'd also like to note that there have been requests for data concerning people who died from COVID versus those who died with COVID, as they are two completely different things. And at this point, to my knowledge, we have not been provided that data. So that's something to keep in mind. Currently, COVID patients take up about 24% of hospital beds, state hospital beds. 2% of those are pediatric patients. In Western North Carolina, COVID patients take up about 17% of hospital beds. And as of the 17th of this month, none of those were children. Again, this information comes from NCDHHS. Also, there's no differentiation in reporting between patients being hospitalized due to COVID and those who were admitted for other reasons who tested positive upon arrival. In a recent MSNBC interview with Dr. Fauci, he went on record to say that if you look at the children that are hospitalized, many of them are hospitalized with COVID as opposed to because of COVID. The current concern is Omicron. However, as we just covered, is proving to be no more deadly than previous variants, which hovered around a 1 to 2% death rate. In fact, it has often been described as being similar to the flu or a cold, and the fact that they literally had to make a guide to differentiate for people the two speaks volumes. Last year, I read you guys a quote from the creator of the PCR test concerning its reliability. These tests can be set to such a level that a small amount of a virus can yield a positive test. Last month, there were interviews conducted on this topic with the CDC director, Dr. Walensky, and CNN medical analyst, Dr. Jonathan Reiner. According to Walensky's NBC interview, PCR tests after infection can be positive for up to 12 weeks. Dr. Reiner states, while a PCR test can sometimes detect the virus when a person is no longer infectious, an antigen test is more likely to turn up positive only when a person is actively contagious. Based upon this, an antigen test is a more reliable test, yet the PCR tests are still used by and large. 12 weeks is a long time to turn up positive. It's essentially 3 months. So allow me to paint you a scenario. Child number 1 who had COVID 2 months ago gets contact traced because of child number 2 who was recently tested positive. Child number 1, who was not actually contagious, could still show positive because they were not outside of that 12-week window. Now that child is counted again as a positive case, though they are not sick or contagious, which skews the data, wrongfully adding to the overall count of children who have COVID-19. So I say all of that to say, if the tests are unreliable, the symptoms are similar to a cold, the disease is still virtually non-lethal for children, and about 98% of the general population survives, I implore you and I thank you from refraining from mandating masks for our children, as they've been proven to do more harm than they actually do good. Thank you, guys.
Thank you. Thank you, Julia. Crystal Jenkins.
Hello again. How are you guys? Again, I thank you guys for your vote tonight. I kind of want to share a little bit more again of my personal story. Since I saw you guys last time, I was quarantined with my youngest one, and now I've been quarantined with my oldest one. Only 5 days this time, but 0 symptoms. Once again, no symptoms at all. So that's 15 days that I've been out of work with healthy children, which is really frustrating and hard for a working mom, and I'm hearing it all over our community. I know it's hard for teachers that are out with kids of their own. It's also hard for parents. Went and talked to the health department about some of my concerns, and they are very hard to talk to and not very transparent. They do tell me that they follow protocol, kind of the same thing that I think you guys are having to do with the toolkit that we see today. The one problem that I'm having though is the students that don't have to quarantine because they're vaccinated. I'm pretty sure if everybody in here was transparent, we all know somebody at this point with Omicron who has been fully vaccinated, who has been sick with Omicron. So to me, this is very discrimination based. I don't like that my child the first time was told she didn't wear a mask correctly, she had to quarantine for 10 days. Second child, she has to quarantine for 5 days, but if she was vaccinated, she wouldn't. That makes 0 sense to me right now when we see on a local level the sick people here that are vaccinated. So I think we continue to discriminate against our kids. Also, when I went to the health department, still 0 hospitalizations in Macon County with kids from COVID-19. One thing that I wish we had up here that you guys don't are suicide attempts. And the one specifically at the middle school that I'm sure you guys are aware of because we pray for them at our church. It's a huge problem this year. Not only that, but drugs. I wish we had a graph for that for Macon County. Why don't we? COVID-19 is still our main focus in Macon County, but we don't give a root and toot about the ones that are on drugs or attempting suicide because of what this has caused the last 2.5 years. That's what hurts my heart. That's why I keep coming and fighting. I don't care if I'm flagged by the National School Board. I don't care if I'm flagged by anybody because I will continue to speak out for what's important for our kids and not what's not important for our kids. COVID-19 is not Macon County's problem for under 18. It should not be something we address in here every single month. But the suicide attempts, the drug problem in our town should be. It's a big problem in Macon County, and I would hope that we would start redirecting some of our focus to that. And for our community, our parents, our kids, it's a real big problem. COVID-19, I don't care what these graphs show because we don't have one that shows 0% of hospitalizations in Macon County up there. None. We can look at it from a national level or we can look at it at a local level. And that's what I've been doing this entire time is what is it causing on a local level, not what Dr. Fauci says it's causing in Washington or in the big cities, but what's happening right here. We have bigger problems than COVID-19 right here at home. Also, I was very confused about the testing that was presented in October. Is my time up?
Yes, it is.
Okay. The testing should be addressed, though, to make it a little more understandable for parents. I thought that we were allowed to test to keep kids in school, and I guess that's not the case. Thank you.
Okay, thank you. Mr. Goodwin, is it Chip?
Got it.
Yes, Mr. Goodwin.
Got it.
Come up.
Well,
Welcome.
thank you. I'm actually going to speak on behalf of my wife. She couldn't be here tonight, but she works with kids in the after-school program at Danny's, Antoine's, and she wanted me to relay that it was, and she's very happy. I know she'll be happy that the board voted the way you guys did, so thank you for that. But she wanted to relay that she has seen 2 upticks. One, when we switched from remote learning to back in school session, I think we can all agree kids have done much better with in-person session than remote session learning. And then when we went to mask optional, she saw another uptick in the kids' behavior, their school grades, their ability to learn, and just their overall wellness was much higher at that point with the kids that she has experience with. So I want to thank you for that. And I have 2 follow-up questions. I don't know if we have the answer, but to me, 2 things kind of stuck out in your presentation, Mr. Rollins. It was very well informed. I appreciate that. But out of the 2,700 quarantines, was that right? How many of those have tested positive?
We don't get into a discussion.
Yeah, I'm just asking. Those would be follow-up questions. And then I would say, if they tested negative, do they still have to wear a mask in the 5 days come back if they've taken a negative test in that 5 days? Because to me, that sort of seems counterproductive to sit there to say that. So, and I know some of that is state guideline and push down, but maybe if there's a channel that can be pushed back on, that would be great. So, thank you.
All right, thank you, Chip. Is anyone that's here, not necessarily on the list, would like to address the board? If so, please just raise your hand. We'll recognize you and you're more than welcome. Don't see any takers. So at this time, I'll call the agenda, our time for public comment to close. Moving on into the agenda. Next on our agenda is informational items, overnight out-of-district trip requests. I'm going to pause just for a second because I think so folks want to come and hear about the mask. If you'd like, we're going to pause in case you're welcome to stay the rest of the time, but then again, you may not want to. So we'll pause just for a second in case you do want to leave. Good. Moving on then, informational items. These are our overnight out-of-district requests. All the board members had a chance to review those. It looks like a lot of them, of course, are just school activities, athletics, and other things. Any questions? Hearing none, I would entertain a motion.
So,
Have a motion that we approve as presented. And do I hear a second?
Second?
All in favor, say by saying aye. Aye. Any opposed? So moved. Next are our fundraising requests. I think we do have, Mr. No is here, and then I think I saw Mark and Sarah was here. So Tim was, what we'll do, guys, if it's all right with y'all, we will just go to those, and if the board members have any questions, be prepared to ask. I don't think you need to make a presentation as such. All right, so first was the Franklin High School. Tim, if you'll pull that up. HOSA, fundraiser. Does anyone have any questions of Principal No? Good. Next is Highland School, our junior class, Sarah, and could be ready. So this was just, I think, a fundraiser. I think this looks familiar. I think they do this every year, do they not?
Yes.
Any questions? Next would be our Macon Early College, the PTSO Walkathon. Mr. Sutton's here also. This is something you've done every year, is it not?
That's the first.
Was it first? There you go. Make like I know something. Okay. We've all had a chance to look it over. Any questions? I love the fact they'll actually be outside. They'll be on the walkathon will be on the Greenway.
Full access to Greenway
Right.
from where it connects to Southwestern's
Good.
property.
Questions? Macon Middle School, Valentine Dance.
We're gonna be all dancing and hugged up together, I guess, right?
I'm not sure about that, Mr. K.
On two sides of the
Here's my thoughts about it. When I first heard about that, I was like, okay, maybe this is something, but the more I thought about it was, if you go to a ball game now, the high school basketball game or any athletic event in the stands, what's the difference in terms of that? So I didn't really have deterrence, but that's just me. Any other questions? Macon Middle School Band? Questions? Mountain View Intermediate School Hat Day. I think this is a repeat, is it not, Dr. Baldwin?
Yes, sir.
Questions? And then PBIS, Tim. This is a new one. I don't think we've had this before, correct?
I don't think so.
I think it'd be a feel-good event for the kids and the staff. Questions?
Move we accept as
All
presented.
right, Mr. Cave has jumped. He does. We have a motion that we approve all the fundraising requests as presented. Do I hear a second?
Second.
All in favor, say by saying aye.
Aye.
Any opposed? So moved. Under policy, summer adventure camp, Mr. Gibbs, I think we're looking at approval for the rates. Is that right?
And also, just to let you guys know dates and location, Summer Adventure Camp was originally scheduled to be at Iola Valley this year, but with geothermal possible issues, so it'll be at MVI this year, starting June 13th to July 29th. If a student attends both sessions, that'll be $1,026.63. The first session is June 13th to July 1st, that's $500. And the second session is July 6th, July 29th, that's $600. So they get a little bit of break if they go to both.
Are these rates are the same as they were last year?
Yeah, I believe so.
Okay. Sir, questions?
I just have a question about the distinction between this and the summer school. Is this the summer school that the county, so we're doing through the COVID money? That's what I'm making sure. This is not the same thing.
No, this is a
Okay.
self-funded
Okay.
adventure.
Okay.
Now, last summer we tried to combine
Combine
Summer
them.
Adventure
Okay.
and Summer,
Summer Venture last year was their physical activity part of summer school. That was required, I believe, Dr. Baldwin, in the legislation, that there be activity in summer school.
along with Danny Antoine's karate school and
Division gymnastics.
and that Hale Learning Center helped with some of the children as well.
And there won't be charged for the one that they could.
Would that be the case again? I'm sorry.
No, I just wanted to clarify that because I wanted to make sure there wasn't.
Will that be the case for summer school again this year? Josh, that it's a requirement for what you'll be proposing, the physical part of it? Okay.
That least at this point, there's no legislation.
Mandated.
Yeah.
Anyway, there's the chart, the dates. No one has any other questions. I'll entertain a motion.
So moved.
I have a motion we approve the summer adventure camp rates and dates as presented. Do I hear a second?
Second.
All in favor, someone saying aye. Aye. Any opposed? So moved. John, are you with us?
I am, yes, sir.
All right. We're just going to take this all as a first reading that you have and going through, and then we'll bring it up at our next meeting after I have a chance to review. Do you have anything particular you want to point out as we go through those?
No, sir, just that I'm standing ready to answer any questions you may have. I also do want to thank you all for accommodating me this way. The positivity rate for COVID in the Henning household went up to 50% just on Saturday. So we're working through with Harrison and Luke, and everybody's okay so far.
Good.
But thank you for letting me be here with you like this tonight. Happy to answer any questions you've got. But yes, sir, just a first
Good.
reading on all this.
Entertain a motion that we accept all the policies as a first reading.
So moved.
And do I hear a second?
Second.
All in favor, someone saying aye.
Aye.
Any opposed? So moved. Thank you, John. Like I said, encourage everyone to look those over, and we'll have actually next time if you have any questions, we can get those resolved, I would think. Curriculum and instruction. Tim, we don't normally look at you, but it looks like you're on the stage for our calendars.
The calendar committee met to discuss the upcoming school year calendar of 22-23. We had some definite challenges this year with the letters training. We brought in Josh and Brooke, and they helped coordinate some training dates and work days for the teachers. We didn't have much room to maneuver this year, and this is the calendar we came up with. And I believe the people on the calendar committee took it back to their schools and discussed it. We didn't have many suggestions. Again, there's not a lot of maneuvering room this year. We did end up with quite a few more teacher work days than normal. We ended up with 27 this year because of the letters training. Another
I'm sorry, Tim, because of what?
the letters training, yeah, the reading. Yeah.
Right.
So that's a significant burden on the elementary teachers. So that requires quite a few training days, and that was 8 training days, Josh, during the school year next year. So that added 8 work days basically to our calendar that we would not normally have to deal with. The other change to the calendar would be that we need to make these work days mandatory for teachers, except we want to exempt December 19th and 20th and May 30th, 31st, and June 1st through the 9th. That's the ending work days there. Those could be optional teacher work days for teachers that they can take their annual leave days on those days. That's a change from last year. The legislation requires that the board set aside at least 2 of the work days that teachers can take annual leave on. This will give them, 11 days that they can take annual leave on. But all the rest of the work days should be mandatory.
Tim, real quick, you'll go through what the state law requires regarding the start of school, when school must end, the required number of work days.
The start of school, we can't start school the Monday closest to I believe it's the 26th.
Monday closest 26th.
Yeah. So that ended up this year being a week later than we normally would start. So that is starting August 29th this year. That put us significantly behind already. And then we had to add the work days in there. We can go up until June 9th with student days. But most of the schools do not want to go past Labor Day because of testing, and it's just very low attendance those last few weeks.
Right.
So they want to finish up before Memorial Day.
Thank you.
anybody has any questions about the letters training, Josh and Brooke can answer those and what's required for the teachers. Otherwise, this is the Franklin area calendar that we're presenting for approval.
Does the board want to vote on each individual one or take all three as a whole? What's your pleasure?
Take them all.
Okay, let's move on to the next one.
Okay.
Tim, please. Highlands, is that the next one or Nantahala?
The next one is Nantahala school calendar. We allow Nantahala and Highlands to both modify their calendar as they need. They did not need as many letters or work days scattered out within the year as we did because they have staff to cover. They have staff to cover those training days. So they ended up with a few more days. They ended up with 170 student days, 1,071 hours. That's for Nantahala. Highlands, I believe, is in the same boat as Nantahala. They did eliminate some of the work days within the school year. They ended up with the same number of hours, 1,070 hours. And of course, they're starting on the same day and ending on the same day as the week.
Tim, what was the number of instructional hours for the Franklin area schools, please?
Franklin area, I believe, was 167. Let me see. 167 or 1,052.1 instructional hours. So we're still well above the 1,025.
Now, how that will impact us differently next year as compared to this year, you know, we've already had 2 inclement weather days that we did not require staff or students to take part in virtual learning on either of those 2 days, but part of that is because we had so many additional instructional hours built into the calendar this year. Next year, we don't have that flexibility, so we'll be more likely to make up inclement weather days either virtually or over spring break, but more likely at the end of May, the 30th, 31st, and the first few days of June. More likely, as long as we can stay above 1,025, but 1,052, that's roughly 4 days, 4 or 5 days, so it's getting close.
So I'd be quiet, but legislators just do not get this, folks. This is just, this whole thing of mandatory start dates with all the things added on, the letters, training, whatever, is just incomprehensible. It really is. It's not about what's best for our children in the schools, it's how they want to control it, that's all it's about. So you put that in the paper too, by the way. Any other questions? At this time, I entertain a motion that we, as far as the calendar, do I hear a motion for approval?
So move.
Do I hear a second?
Second.
All in favor, say by saying aye. Aye. Any opposed? So moved. Very good. Letters, training updates. Mr. Lynch.
Yes, so a few letters, updates, and then a few recommendations to go along with that. The good thing about it, all of our schools have conducted their kickoffs. That occurred in January, the 5th through the 13th, and those went really, really well. We have also established some dates for the virtual training that has to occur, and these are at basically the discretion of letters. That they basically give us a pool of dates that we can choose from, and we try to make it work the best that we can with their schedule and with their calendars. And so you have the dates there for each of the individual schools. And we have decided to do post meetings, which is basically the teachers engage in the work. And then we have a follow-up meeting with the letters trainers. And that was basically the setup that the teachers and the principals wanted to go with, which makes sense, just to have some follow-up in regards to that. So we have Unit 1 and Unit 2 at those particular dates. So with that being said, the recommendations that we need to look at and get approval for would be Highlands and Nantahala. They're going to utilize Friday, March the 11th for Unit 1, and we are going to provide subs for those individuals to do that. And I have enough money in Title I that we can cover that without any any major thing happening. So we want to recommend that. And also converting the remote instruction day that we have coming up on March the 21st to a professional development day for teachers in the Franklin area, so that they can engage in that required unit work with the LETRS trainers. And following up with that, to also recommend a teacher work day on Tuesday, March the 22nd, so that teachers can do their report cards and plan for the remainder of the year. And within the confines of LETRS training, we don't have a lot of information on it, but there is a PRC 085, which will be funding for LETRS stipends. And we don't know allotments or planning allotments at this time, that they're still being developed. But we recommend that we give teachers stipends for each completed unit once those funds become available. And depending on what that funding looks like, if the funding source is not available to cover all of those teachers, I would recommend that we take additional stipend out of Title I as well as ESSER, just to have a blended funded model. And we can definitely do that within the allowable usage of Title I as well as ESSER 171 and 181. That would address learning loss as well. And then at the end of the year, on Tuesday, May 31st and Wednesday, June 1st, we would recommend that would be a required Unit 2 6-hour LETRS training to follow up with what teachers have already engaged in. So I know that's a lot of recommendations in regards to LETRS, but I feel like that will position our teachers in the best light possible, take advantage of these days that we have in the calendar, as well as be a good steward of the funds that will be available. And just for your knowledge, the teachers so far, they have really engaged in the extensive work that this has required. They took basically those snow days and really intensely worked on engaging in that unit work. And just the reports that the teachers gave to us, they said having those days back to back really allowed them to get in, dig in, and kind of get through those modules. And so that will be basically how our structure of the calendar next year will look, and it will allow them the time to engage in that as they complete LETRS.
You back up the 31st and June 1st. Were those originally instructional days, Josh?
No,
they're not.
They were work days, but they were not required.
You probably mentioned this, but this works with all of the schools listed here through their leadership and with their calendars.
Yes, the thing that all the principals have been able to do, just within the confines of the school year itself, they have been able to provide at least a day or two each week to allow their teachers to engage in this work, either by providing personnel or tutoring or whatever the case may be. Each school is doing it a little bit differently, but they're making it work and they're doing it really, really well. So this would just allow us to really engage in the time as an entire district and have the supports that we need in place to make that post follow-up occur. But yeah, the principals have done an amazing job at all the sites, providing just the level of support that's needed. And Sarah can attest to that because it's not easy to provide the time, but they are making it work with the personnel that they have in place. And we appreciate that.
Any other questions? I think we'll need to approve the presentation, especially in terms of the dates. So do I hear a motion that we approve the training dates for LETRS as contained in the presentation by Josh? Do I hear a second?
Second?
All in favor, simply saying aye.
Aye.
Any opposed? So moved. Thank you, Josh. A lot of work. Summer school proposal.
So for our upcoming summer school proposal, at this point, we do not have a legislative mandate that states we have to require what we provided last summer. So therefore, the legislation, it basically speaks of what the Read to Achieve camp needs to look like. And it was very, very specific as to the individuals that would need to come to that camp, which would be second grade and third grade students. So therefore, after we conducted the camp last year, we polled our workers, and they basically gave the dates that really worked best for them, as well as they thought would work best for student development. Having a little break after school shuts down, starting back up in July, and then being able to have another break right before they welcome students back in August. They thought would work best for them. And so we're proposing that we have a planning date on July the 5th for teachers, and then the dates of the camp would run from July the 6th through July the 22nd. And beginning around 7:45 and then concluding at 1:45. Of course, we'll have bus and transportation and meals provided during those times. We are possibly looking at around 16 licensed teachers to be hired for the camp. And if we need more due to numbers, we will definitely do that, but we feel that will be a good sufficient camp where we have a student-to-teacher ratio that can really get some intensive work completed. And we would like to throw it out there to the teachers that, if they can commit to work all 13 days, that, is best practice. But we will also work with teachers who might need to do partial in regards to that. So we definitely want to pay them for their planning on July the 5th, and then have a little bit of planning built into the instructional day from 1:30 to 1:45 that the workers would be paid for. And I had a discussion with Sandra McMahon, the principal at East Franklin, and we were proposing that we have the RTA camp at her school. And hopefully we can just use the bottom section of East Franklin downstairs so that we can allow them time to strip floors and do whatever they need to do up top and not be such a disruption to their site while we're hosting that camp on site. There talks about the requirements for individuals, of course, third grade students who do not meet RTA requirements, and then second grade students with some deficits that will need intensive tier 2 support so that we can hopefully save them from being an RTA student and work through their specific needs. And then we have listed basically the instructional components that we would implement during the camp that we've had great success with, that are all research-based, and our teachers are very fluent in terms of knowing exactly how to deliver that instruction. The one thing that is new to us this school year is the Hegarty, and we piloted that last summer with great results, and we have specific sites and specific grade levels that are carrying through with that right now, and just the feedback that we have received in regards to that, the teachers are loving it and they're showing some great gains. So we're going to actually implement that into the whole camp this upcoming go around. So we're really excited in regards to that. And then the second phase of our camp is for the English language learners, which would focus on second and fourth grade students. And this was specific to PRC 176. We had to choose a demographic population within the county that was adversely affected by COVID-19, and that we could really implement some powerful reading focus as well as vocab focus. And so based upon our preliminary data, it was for our English language learners in those grade levels that we needed to focus on the most. And so we're proposing that we kind of follow in line with the same dates running that camp, just so we can have transportation in alignment as well as meals in alignment. But this camp would be at Cartagena, which would also allow that site to not be totally disrupted by a camp, but I feel if we held it on site at East Franklin, that would probably take that entire site, and it would really disrupt their summer plans. So both principals at Cartagena and East Franklin are in agreement that they would definitely like to host. So we have their blessing in moving forward. So those are the proposals in regards to our summer camps. Now, if legislation were to change, and we all know that can happen quickly sometimes with funding, I will definitely make the board aware, and we will begin planning for that. But at this point, this is the only summer camps that we will engage in right now.
This is ESSER monies, is that not right? Or
The
not
PRC
funding?
176 is, yes.
Good deal.
And it was very specific as to how it would need to be spent out. It's basically what they call a summer bridge program.
Any board members, any questions of Josh? Getting a lot of work. This time I entertain a motion that we accept the summer school proposal as presented. Do I hear that?
So moved.
Do I hear a second?
Second.
All in favor, say by saying aye.
Aye.
Any opposed? Very good. Again, Josh, you've been busy. Thank you for all your hard work. I appreciate that. Somebody else has been very busy. Mr. Gibbs.
Yes, sir, Mr. Chairman.
Versus
Iola Valley
Iola Valley.
Geothermal update, the RFP has completed. Remember, we only had one contractor that submitted a bid the first advertising go-around, so then by law, we had to advertise again. That same contractor rebid, and it was the only one. That is MSS Solutions out of Charlotte, North Carolina. Bid on both the controls and the repair of the geothermal piping. I called them last week and let them know that they were the only bidders they wanted. I talked to Mr. Henning today, and he'll be working on an agreement for you guys to approve and sign for the February board meeting. So
If I can ask, did we have a final quote as far as pricing?
Yes, sir. The controls were, the proposal from MSS was $74,819. That's just for the controls. And they said that they would stay to this pricing. I talked to them last week, because this was done a while ago. And the bid for the piping, replacing cutout joints on mains in place with electric fusion couplings within the building, $575,640.
So in line, actually a bit less than what we originally thought it would turn out to be, correct? I figured we thought maybe up to what, 750, something like that?
And again, this is just to replace the welds.
Correct.
That's correct.
Yeah. The other issues, little tackle as we get.
And the controls.
Right, good.
Again, I talked to MSS last week. They said that they can hold the line on this pricing, and they do have us on their schedule.
Thank you, Tom.
And the agreement Mr. Henning works on will be the formality to make it.
We'll please have that ready for us probably by the next meeting. That's
Yes, sir, that's correct.
Good deal.
We'll go ahead and keep it MSS working on that project, though, to make sure that
Yes,
it's
sir.
done this summer.
Yep.
Mr. Chairman, before we move from Iowa Valley, Todd, do you want to discuss the issue that we have that's ongoing out there that's caused for concern?
It was reported to us by Miss Bell that there was a wet spot in the parking lot. The main parking lot is actually the well field for the geothermal. So under the parking lot out there, the asphalt are about 100-foot wells of geothermal. And she noticed a wet spot on the pavement after days of it being dry. So we're thinking the only place that moisture can come from is down below. What goes with that hand in hand is that our maintenance guys are adding water to that system almost daily. So there's water leaking from the system somewhere, and it's nowhere in the building, because we would know that immediately. So we think that that leak is probably somewhere in the well field underneath the parking lot, which is much more difficult to get to, obviously.
If we would have to replace that well field, that estimate was another $1 million, $2 million.
That was $1 million, I think it was $1.2 million or $1.4 million.
And you can't go in and where the wet spot is, cut through the pavement and go down and hopefully.
We can do that.
But the problem is that it's no longer wet, and we still have a leak.
That's correct.
So
Water and a leak underground could be running from
Found in a
anywhere
new
to
channel, ain't
anywhere.
it? Made it a new channel.
The wet spot that came up could have been a spring from underground that doesn't have anything to do with geothermal, but we still have a leak somewhere where we have to add fluid to the system almost on a daily basis. What goes on top of that is when you have fluid escaping, you have air ingressing into the system, and that's called water hammering, where the water and the air, it's like a hammer on the inside, which is really difficult on the welds. You have to bleed the air off like you bleed air out of a hydraulic brake system.
And the other issue is that as long as it's leaking, we're losing that glycol, which makes it much less efficient.
I thought we'd come to the stage where water, the glycol level was getting down where it's about almost water now, right?
It's probably straight water now, would be my guess.
And even if we correct those wells within the building, unless there's a well that's in a wall that we just can't see.
But our estimate of how much water they're adding over a weekend from Monday to a Friday to a Monday is about, and it's just a guesstimate, 200 gallons of water were added on a Monday. So where did 200 gallons
go? How big is the
go?
pipe that rotates through those, to the wells? How big of a pipe is that?
Well, the pipes vary in size from, I think that big one, that big vertical is probably a foot.
In the wells.
In the wells.
In the wells.
In the wells themselves,
Oh, I'm
that's
sorry.
it exits the building. What size
Yes, sir.
pipe is that?
The ones, I don't know for sure, the only ones I've seen come out of the junction box outside, and they're probably 6-inch.
We're losing about 200 gallons over a weekend?
And again, that's a guesstimate.
Guess what? Yeah.
Yes, sir.
Because all we know is that we're losing pressure, we don't know the amount.
Right. Even if you cut that in half, that's still 100 gallons.
100 gallons.
If you force it, you're looking at 50 gallons, which should be somewhere.
Right.
I think there's 400 100-foot wells. And if we have a leak in the bottom of one of those wells, if that's where the leak is.
And we could have the wet spot here, and it could be the well that's 50 feet that way.
That's why we said water has a mind of its own.
Yes, sir. Takes the easiest path.
Yep.
The main thing is that we will have, we hope to have the leaks that we've seen within the building corrected this summer and avoid a potential catastrophic flood inside the building.
Right.
But until we get those exterior leaks corrected, that system's never going to run efficiently. And we're kind of boxed in now because of the supply chain issues. We can't back off of correcting the welds inside the building and going for another system because we couldn't have a new HVAC system here this summer now if we wanted to go in a different direction. And I don't know if we can do it any cheaper anyway. We don't know that.
We don't know that.
We don't know what would involve what would be involved in converting from a geothermal system to a traditional chiller, heat exchanger outside.
I know we talked about that some, but I guess we'll just have to get the interior done and then we move to the next section.
And if we get the interior done, and we talked about possibly just putting a chiller, heat exchanger near where the geothermal enters the building. That is a possibility, but we couldn't do it. There's no way we could get the parts here this summer.
Well, you need an engineer to tell you whether you can do that or not. Instead of using the earth as the heat exchange, use the chiller and the mechanicalness of the chiller to do that.
Not good. But it is what it is. Well, we'll know better as we move into it at this point. Thank you, Todd. Sewage treatment update. Hale?
Yes, sir, I have. We had plans in 2014. David Curtis had plans that were supposedly shovel-ready for a replacement of the Nantahala School wastewater treatment plant. For whatever reason, we could not act on those plans until now. I called the state of North Carolina DEQ, Department of Environmental Quality, to see what we need to do to submit those plans to them, to approve them, so we can see how much it's going to cost. When I called NCDEQ, they said that the plans needed to be engineer stamped. So I took the plans to Larry Lackey here in town, CE Tech Engineering Associates. He's working on the approval process and the stamping of these plans that we had. He and I have been in a thread, email thread with a Charles Weaver for North Carolina Department of Environmental and Natural Resources, Mr. Lackey, and a number of other people. You have to take into consideration soil, where your sewage plant is, where the effluent is going to, how much water is flowing out of the plant, if it's flowing into a creek after it's been treated, the flow of the creek, etc. There's just a lot of regulations, requirements, and stipulations from the state on a plant like this, and Mr. Lackey is working through that.
Can you give us any estimate of time frame about when we'll have the information so the project can hopefully be started?
I can't with any certainty.
And we don't know the cost yet either.
Yeah, just based on what you're talking about, the cost obviously would be going up.
If that's a project that would need to be completed this summer as well, it's something we'll do during the school year.
I'll put your spot one more time in your conversations with folks. Do you think there's a possibility to get all of the approvals in time that we could do that this summertime? It may be impossible for you to answer that.
I wish I could even guess,
right,
Mr. Chairman, but I would hesitate to do that because it would not be right.
Good. Fair enough. I understand. Hey. East Franklin Elementary RFQ update. Give us some good news.
Yes, sir. Angie and I worked on the RFQ. It was submitted to the Franklin Press and the Greater Diversity News, advertising for a response for qualifications for architects on the East Franklin addition project. It was issued to those two publications on January 10th. We'll accept responses through February 25th. We'll compose a committee to evaluate those architects who submitted qualifications on March 7th. Hopefully approve one of those architects to lead the project on or around March 11th. For the board meeting on March 28th, have a architect to you guys that was chosen by the committee, and hopefully you'll approve an architect for that project. And now the next three dates are what we see, but it may be different depending on what an architect sees. An architect would submit plans on June 15th. Construction bids issued on July 1st, and bids would be due 8/1 from general contractors.
Question. Will that interfere with your situation, East Franklin?
No, what we're talking about will be down the road. By the time we get there and actually get started construction, we're well into almost, I'm afraid, till next year.
This is planning and
doing the very
The
same.
project must be completed by December of 2024.
Refresh my memory. Our South Macon project, once they actually got started on it, how long did it take to complete that?
It was 18 months, but it was delayed, if you remember correctly. The rain that year was incredible. But they did get it completed in 18 months.
So we are pushing the limits right now.
Yes, sir.
The advantages that we have at East Franklin is that it's similar to South Macon, is that it can be done while school is in session. So if they can begin in January of 2023, you have a possibility of being done by the summer of 2024. They wait until the summer of 2023, you're stretching, you're putting yourself in a corner.
Questions?
It's going to be close.
Appreciate you, young man.
Certainly.
Been busy. Dr. Baldwin, needs-based public school capital fund. Thank you,
Yes, Mr. Chairman. We polled the board on this, but just some information. The needs-based public school capital fund was established to assist counties with critical public school building capital needs. This is executed by the North Carolina Department of Instruction, and it's funded by the North Carolina Education Lottery. The county has applied for this grant, and if awarded, could receive up to $50 million in matching funds for the Franklin High School project.
And of course, we don't have any knowledge of our odds, but we're in the, we've done what we need to do, and at least all you can do is tell us no now, right?
We are courting the right people.
There you go. Well, I'm sure you'll keep us, as we move forward, you'll let us know as we hear things.
Yes.
Bonuses and finance. Angie, employee bonuses.
Tim, if you'll pull up that bonus grid.
I think this is the handout that
It is, and I
Angie
gave y'all a
everyone.
copy, but I know it's hard to see, so Tim's going to pull it up so you can kind of look at it. I'm going to go through the first one. That first bonus there is PRC 045. And I will talk about it in conjunction with the second one on the second page that you have, is PRC 203. These are bonuses that the state has mandated that we give teachers. So the criteria is to be eligible a teacher or instructional support personnel that was employed in a public school unit as of January the 1st. And when they say instructional support, the definition of instructional support is typically guidance and media, and it is a person that I could normally pay out of a 001 or a 007 position, which is typically your classroom teachers and your guidance and your media people. PRC 045 is a $300 bonus. PRC 203 is a $1,000 bonus. So I'm obviously lumping those together and considering those a $1,300 bonus because those are pretty much the same groups of people that are eligible for those. We do have about 15 people that are not eligible based on the law, but they are serving in positions in our school district that require a certification to do what they do. So, but by law, those people would be left out of this bonus.
No, they're
also-
locally funded.
Locally paid.
Not necessarily those are locally funded, they just don't meet the criteria of the certification. But we also, like Dr. Baldwin's referring to, is the other criteria to this bonus is they have to be state funded. We also have about 69 people that are in the category whether they're either locally or federally funded. So that would leave those people out of receiving this bonus. So the total cost of that would be, if you lump the two together, the two groups together, that would be about $117,500.
And Jake Sundance, the 15 was different. Why? The first we gave, we had 69, whatever, but the 15 they were not
The
necessarily locally
15
paid.
are not certified according to the law that the state has given for this specific bonus.
These are classroom personnel.
They are not classroom people, but they are serving as instructors or, in some cases, like a mental health professional. Like a mental health professional.
So you're talking about...
And they're certified, they have to have certification, but they are not certified.
Wording is the thing because it's teachers and that just simply
Correct.
excluded those folks.
That's right.
We're not responsible for
No.
that exclusion.
No, we are not.
Would it include teachers who are under emergency licensure?
Yes, we can do those.
Out of state?
If they are paid from state funds, yes. But most of if our teachers are not certified right now, or we're waiting on their certification, we don't usually put those on state, but if they would be eligible to be paid out of that 001 or 007 pot of money, then yes, we can pay them out of the state fund bonus.
I'm confused about the 15 that are not licensed.
They're not required to have a license as far as teacher certification. They don't have teacher certification, but they are serving in an area
For-
mental health specialist.
like a mental health specialist
Or maybe a
or
psychology
a social
degree,
worker.
or social
So
worker.
are these, are they ineligible for the, which one of the most are they not eligible for?
$13.
The 045 and the 203.
So,
Because it says to be eligible, they have to be a teacher or instructional support and be able to pay out of the 007 or
but we
001.
don't consider mental health professional teachers, I do.
No.
No.
Or a social worker who is not necessarily a school social worker or a guidance counselor. But we might have one that does that. But they have to have a certification to be able to do their job that they're doing.
But basically what you're saying is that's kind of out of our hands. They just don't meet the definition based on the
That's
state.
correct.
But now the other 69 that is strictly because they are what we call locally paid
Or federal.
or federally paid. So that, to me, comes back to us. And how much for those to do that? It's going to,
That's 96.5.
okay.
Do you want me to go on to the next bonus, or do you have some more questions about that one?
No, I just want to clarify all the board members. Basically, that's what that is that is to sit there would be penalized because of decisions that we have made, not their own decisions, because we have to move on to local and other things. So, yeah, we need to keep that in mind as we go in. It's not their fault.
There's probably not any teacher out there that knows whether they're state,
Right.
local, or federal funded. It
Gotcha.
doesn't,
Okay.
no, it's irrelevant to them.
So that's 96.5. Okay. Next.
The next one, the second one down on that list is PRC 48. Those are AP bonuses and CTE are the two that we have eligible teachers for. And we had about 5 teachers that received those. Those are teachers who are teaching AP courses, and based on the scores that those students have that are taking those AP courses, those teachers are eligible for a bonus. And the CTE, we had 2 teachers in that category, and those are CTE certifications that when those students complete that course, they have some type of certification in a particular area.
Or credential. CT likes to refer to them as credentials.
And so all that will be money provided to us by the state,
That was
correct?
money provided by the state. PRC 48 is totally state provided.
We don't have anyone that falls into the category we're talking about due to our
No, we do not.
Okay.
No. The next one is listed as PRC 62. I'm being told now that it's going to be PRC 71, and that's a small county in low wealth. That one is still in the works, and we don't have a whole lot of information about that. These others that I'm talking to you about specifically have to be paid out by the end of this month, January.
No, we probably won't qualify for 71, will we?
Probably not. The next one is 48, PRC 48. Those are principal bonuses. And this is any principal who is state funded, which all of ours are. So we don't have any that do not fall into the category under the state. So we have 12 of those, obviously, that are eligible for that bonus. And on the second page, we have PRC 141. And this is a state fiscal recovery bonus, premium pay bonus. And that is to all eligible permanent employees in the school system, regardless of how they're funded. So that is pretty much all of our full-time people, and that is a $1,500 bonus unless their salary is $75,000 or more, and then they will receive $1,000 only.
That's pretty much everyone we got.
That's pretty much everybody that we
15.
have that is full-time and permanent. And for their definition of permanent, it's anybody that is 20 hours or more a week.
Okay.
We won't have to come out of local out of any for that.
Correct, that's all state paid, that's all, the state is providing all the funding for that.
The only people that we have in that category, we do have some bus drivers and school nutrition people that are not over 20 hours. So we do have probably around $20,000 worth of people that should be prorated if they're 20 hours or more, but we do have some bus drivers who don't work 20 hours or more.
Again, this is a deal based on the state funding and their guidelines, correct?
Yes, that is correct.
Okay. All right, and we got one more, Angie, correct? Or did I miss it? Esther Residential Scoop on us?
Yes, and I don't have I don't have any information about that one at this point in time.
That's for here in school system.
So let me clarify and make sure I'm on the right track here, Angie. So the ones, all the bonuses talked about, we're good. The state is giving us the guidelines and they're providing state funding, except the ones at risk right now is we have 69 employees
Yes.
who, because of not their decision, we have chosen to pay them out of local or whatever. And to make that right, it would cost us a total of $96,500. Is that right?
And also those bus drivers. Let's talk about those bus drivers.
And some school nutrition.
Would that be included in that figure?
To prorate those folks for the aggravation that Angie and the finance department will have to go through, we'd probably just money ahead to go ahead and pay them as if they were full-time.
And there's not that many because a lot of our bus drivers are full-time employees, teachers, or custodians, or whatever, so they're getting it anyway because of their other job. So there's not that many other bus drivers who would not be.
And any up here we get to give bus drivers, we need to take advantage of it.
So technically, does that 965 give us some monies to include what Dr. Ball's referring to?
We need to add about,
We're up to the 117?
yes.
So to do what Dr. Ball's referring to, we'd go from 96.5 up to 117.5. The 117.5 will give us money to cover everyone, correct?
Yes.
Okay. See, someone's already nodding their head, so I'm going to open the floor for a motion at this time. Ms. Arnold.
I'll make a motion that we do the 117.5 to include all employees.
And that would have to come out of our fund balance.
And that'll come out of fund balance.
Well, it could be blended funding from part of the ESSER monies that we have.
So
I don't think that I don't think it will be necessary to take anything out of local funds. to do this.
Okay. So basically, the motion will be that we do that to seek the funding out of ESSER, and if a small amount is left, to take that out of local. Ms.
We
Arnold,
have
is that right?
2 or 3 different grant applications. Brooke has received a couple for EC and
Okay.
pre-K EC. Josh has got a couple, or one in particular that he's got. And then we have our ESSER funding on top of that. So I think between blending all of those.
And that also, the good thing about those other 2 grants is that that reduces the impact on our ESSER 3, that original budget that we've been working with.
It does not affect 171 or 181.
But we'll leave the proviso in that if all those don't cover, then if we have to dip in fund balance, the necessary amount, we'll do so.
I'll second.
Have a motion and a second. Any other discussion? Hearing none, all in favor, say by saying aye.
Aye.
Any opposed? So moved.
And Angie and her girls really like to hear the word bonus.
Particularly when you say they're due January 31st.
It has been a real challenge for them, and just like to make the board aware, you'll probably hear questions about folks' checks this month, because it has been a nightmare. I'm sure that there are going to be a lot of questions from a lot of folks, but we'll just answer them the best that we can. If there's mistakes or revisions that need to be made, we'll catch up in the coming months. Just we ask people to be patient.
Good deal. Please pass on to your department, Angie, our appreciation. And you.
We love you and all.
I think next is our fund redistributions.
We actually do not have any for this month.
Good deal. IRS mileage rate, I think they bumped it up slightly.
They did bump it up. It's been 56 cents for actually the last couple of years, but they have, as of January 1st, it's bumped up to 58.5 cents.
Entertain a motion that we adopt a new rate for our school system as recommended by the IRS to 58.5 per mile.
So moved. Second.
Have a motion and a second. All in favor, say by saying aye.
Aye.
Any opposed? So moved. Audit contract, Angie.
This is the same firm that we've been using for the last several years. I think it's a little bit of an increase, it may be a $500 increase than what, but that is the first increase we've had
That's
in
it.
probably the last 5 years.
And you have enjoyed working with them, correct?
Yes.
I entertain a motion.
Motion to accept.
Motion to accept the contract with, their name is
Anderson, Smith, and White.
Anderson, Smith and White. Do I hear a second?
Second.
Any other discussion? All in favor, signify by saying aye.
Aye.
Any opposed? So moved. Surplus resolution.
We have 2 vehicles that Randy Studemeyer, the Transportation Department, feels that it's necessary to surplus at this time. It is a Ford van and a Dodge Ram, and you can see Ford van is a 1995, and then the Dodge Ram is a 2002.
I drove that van, was brand new.
4-year-old, ain't you?
That's a big number up there now.
I'm sure we use it. Yeah, we get to the point where it's almost dangerous before we do this.
Really?
So, I entertain a motion.
So moved.
A motion that we accept the resolution, surplus resolution presented. Do I hear a second?
Second.
Any other discussion? All in favor, say by saying aye.
Aye.
Any opposed? So moved. You don't want to write that thing down, weren't you there, Dr. Baldwin? Board of Education information at this time. Coming events, Dr. Baldwin, I think we only have maybe one, is that right?
The next board meeting will be on Monday, February 28th, here at the boardroom at 6 p.m.
John, you still with us?
Yes, sir.
You're up, if you would. We'll go to closed session.
Yes, so the reason for the closed session is 1 GS 143-318.1181, written disclosure of privilege of confidential personnel information including GS 115C 219-221, and student matters pursuant to GS 115C-402 and 20 U.S.C. 432G, as well as 143-32.1183, consult with an attorney employed or retained by the public body.
The board has heard the motion, the reason going to closed session. Do I hear a motion?
So moved.
Go to closed session. Do I hear a second?
Second.
All in favor, say saying aye. Aye. Any opposed? So moved. Prior news folks, we're not expecting, I don't think really anything we're taking, but I'm sure they'll get it with whatever we come up with. Renee will get to you first thing in the morning. All right, thank you guys. Thank you everyone. So if y'all would excuse us, we'll be holding a closed session in the room. Thank everyone that came tonight.